chicken wing. How about that? At this point, I just want a chicken wing, something to eat. How much is it? $23? You Lloyd, $23 for a chicken wing? Oh, that's highway robbery. Now you know we can't get out, so you hiking the prices up. Stop it. What? I don't believe. I just don't. I don't believe this. Who does that? Look like everybody's doing it. All right, just bring. Just send the chicken wing. All right, I already did it online and everything like that. Yes, I got all the little the food places, online. Come on, just send it. Because my girl is about to come on. My girl with the bad show is about to come on. I don't miss her. I want to get my chicken wing on when she gets on. Okay. you know. All right, well, I gotta go because I gotta see. Because this is the Lisa Baxter Show, giving you the 411 in the kidney world. Hey guys, happy Mother's Day to every woman out there, every mother, every surrogate mother, stepmother, godmother, grandmother, mother of the mothers. Happy Mother's Day to all of you. You deserve it. We thank you for your service, your love, your nurturing, and everything you've done to brought your sweet children up. Thank you so much. Thank you, thank you, thank you. Well, we got a great show for you tonight. Woo, great. I thought I'd never get this woman on the show. I had a piece of her one time when we had one of the champions event, and she did a little 5 minute, 10 minute little talky talk. But this time I got her on the show to do something so you can really know about her journey, her kidney journey. Okay, all right. Let me describe her first. Put your hats and your seats on. Okay, buckle up. This is a ride for you. Okay, Stephanie Dixon. This woman, oh please, she got too many jobs for me. I hope I can read them all right. She's a kidney warrior. She's an advocate. Oh please, what isn't she? All right. She's a CKD champion. Oh man, she's been with ESRD iPro for, I mean, like forever. And oh please, she worked as an administrator. She just got so many jobs, especially dealing with health. And who knew that she dealt with even being a musician and musician running in her blood and in her family. But honey, she's gonna come on and she's gonna tell you, I'm gonna shut it up and I'm gonna sick my sister on right now. Come on, come on, come on, Stephanie Dixon, the
Hey,
queen
Lisa.
of queen. Hi, girl. The
How you
queen of
doing?
clean and hand washing is her scene. Come on here. How you doing?
I'm doing just fine, thank you. How are you? Happy
Alive and
Mother's Day.
thank you. Happy Mother's Day to you too. Happy Mother's Day to
Thank
you.
you.
You looking good and you looking festive.
Well, I'm not home, but before I go out, I suit up. I double
Uh-huh.
mask.
Uh-huh.
I glove up, all of that. But I'm in the house now. I'm not in my house, but I'm in the house. I'm at my granddaughter's house.
Okay. Well, they look showing some love for you over there. I heard you saying you playing games and stuff like that, doing a little listening and that. That's what it's all about, spending time with family. I would say spend time with God, spend time with family, and get to do some things you don't get a chance to do.
Exactly. Craft projects, put my name down. We got a craft project coming up. About to
You
make
ain't
a
never.
wigwam.
Woo, you got work after this. I ain't mad at you. I just
Exactly.
want to have some dinner. I just would like to have some dinner. I'm a little shaky, but God knows all things, and I'm getting through this. Man, you're and you got so many jobs. You're an infectious prevent prevention ambassador. I thought that was cool when I read that on the thing that you're doing tomorrow, because you're doing a webinar tomorrow, and I signed
Yes,
up
what I
for it.
tell.
Right.
Thank you.
So yes, and I shared it for other people to sign up on it too, to learn
Thank you.
and hear more things from you.
I'm
People,
looking forward to it. But that one is tomorrow is not focused on infection prevention. But
No,
that
you got
is
to find
my
them jobs. I
no,
know
no.
one of them jobs you got.
Yes, well, we do so much. I tell you, there's so much out there in the kidney world, so much that people need to know, that we all need to know, we all need to put into good practice. And with this
That's
COVID 19 floating around, that
mhm.
puts a highlight on infection prevention. One of the things that puts a highlight on is infection prevention.
Well, okay. That we gonna draw right in there. Then I know you're a health educator. Now, before we get into that, what did you used to do before you got into the different things with health and all the wonderful things that you do now, all the projects and stuff? What did you do employment wise before? If you don't mind me saying.
Mainly, I did office administration, office management. I ran many high level law firms,
Hmm.
for profit, nonprofit, and I also worked in investment banking. And I worked at the post office just to make some money when my children were younger, but
Hmm.
mainly I did office management.
Wow. Well, how was that? Did you like those jobs?
I wouldn't take a job I didn't like. I have walked off of interviews. No, I wouldn't take a job if I didn't like it, the atmosphere, the pay, whatever. I wouldn't take a job. I took the job at the post office because it paid enough. It didn't pay what Fortune 500 pays, but it
Mm.
paid enough that I could pay my bills
Yeah. When I
and
worked with
stay
the
home
post
with
office,
my
I got
children.
paid. Oh, that's good. That's
Yeah.
good. I like doing the post office. I only did it seasonal, and I had a good time. But my family had dealt with the post office. Okay. All right. So, okay. You had a job. You had more than one job. You're a mother. You're a grandmother, and you had
Yes.
three children. Okay.
Yes.
Now we talked about employment. Let's go into your journey of how did you find out that you had to go on dialysis?
I went to the emergency room with my daughter. She was 14 years old at the time. They hooked me up to the blood pressure machine. My blood pressure was astronomical, and a doctor happened to come past the station that I was at. And, we said hello. And then he glanced at the blood pressure machine. And I didn't realize I was close to having a heart attack if I had not gotten treatment. And
Mm.
then he said, "Come with me." And he took me and they put me in the ICU. And that was basically it.
Wow. Wow. Whew. Now I know that had to be something because I mean in my 30s and 40s I went stroke level because my pressure and stuff got high. It was fine, in
Hmm.
my 50s and everything, but boy, then so I couldn't imagine you finding out this. You could have had a stroke, you're in the emergency room, and
Hmm.
bam, they told you had to go on dialysis. How did you take that when they told you this?
The doctor said, "You need dialysis." I didn't even know what dialysis was. I didn't
Mm,
even think to ask, maybe because I was in brain fog or, toxic overload, whatever. But he said, "You need dialysis, and if you don't get it, you're going to die." What reverberated with me was the word die. So I thought I was dying.
it's stuck in your head right here.
It stuck in my head.
Yes. Wow. Wow. Mm-mm-mm-mm-mm. Okay, so I know when you had heard this, and your 14-year-old girl daughter that was a teenager have heard this as
Mhm.
well. You know, I don't know if they understood either. Since you didn't understand, maybe the kids wouldn't or didn't. Did you had to talk to them or break it down to them, or was they alarmed in any way?
Well, I tell you, my mind was so cloudy. I said to my daughter, "You need to listen to these people."
Hmm.
I allowed her to make my decisions for me. I was in no condition to make decisions mentally. I just could
Yes.
not. I said, "You need to listen to these people because what they're saying to me is going in one ear and out the other. And then you
Wow.
need to tell me what to do." And she did. She spent the night with me in the hospital. in the bed. The nurse came in the room in the middle of the night, and she didn't have a problem with it. She's like, "Oh, and she didn't even know I had a daughter because I went in the daytime. But the night
Okay.
nurse came in the room, and she said, "Oh," and she didn't mind that my daughter was in the bed with me, and that was it. That was basically it. She made my decisions for me.
The 14-year-old?
A 14-year-old. Since
Wow.
then, she's become an RN. So,
Wow, you raised her right.
okay,
Now, a 14-year-old became a caregiver. I had somebody on the
exactly.
show that had their children involved in dialysis. And I always believe you should school your kids about what you're dealing with, school your kids about what's wrong with you. And you got to know something about it yourself, even before you
Exactly.
involve them. So, wow, wow. Well, so you told her this, and did she take it hard or easy? Because, some kids like, Mommy, I don't know, or I can't
No,
deal with this.
she took it in stride. It was no problem. And I didn't even, like I say, I was mentally out of it. And I didn't even think I'm putting this burden on a child. I'm asking a minor to make my decision. But I knew she was an intelligent person and able to discern right from wrong, good from bad, whatever. It wasn't like I had to have surgery and they were going, cut me open and she had to decide. I just
Yeah.
needed her to remember whatever it is that they were telling her so that the rest of the family could find out later because I wasn't going to in condition to remember.
Well, I can see you, and I don't know why your screen is just frozen, but it is a reality show. Maybe it'll loosen up. I don't. Mm. All
Okay,
righty, but we can hear your story very well, and we want to
okay,
definitely hear it. And
okay.
I love the outfit and everything.
Oh, thank you.
So, but if you feel like you need to move or anything, you let me know. If you want to, exit out and come back in, or just we could just keep going, whichever is better or easier for you. But I do see you on the screen. I see no movement, but I see you on the screen. But that's how it is in a reality show. I just heard the baby crying, so that's how it is. Stuff happen all the time, and we work with it. We keep it rolling.
Okay,
We
well
keep
on
it
my
moving.
end, I'm moving on the screen. But if you want me to go out and come back in, I can do that.
No, if you moving on the screen, the only one that would send me anything if anything was wrong would be Steven. He has not texted anything, so it might be great on both ends. I ain't mad
Okay,
at you.
okay.
All right. So
Hmm.
moving right along. So you heard the news. Your daughter stayed in the bed. Nobody had a problem. So that's a good team because sometimes teams work against you when you're sick or ill. So you had a good team working with you and allowing
Hmm.
certain things and helping you through this thing. How was your experience going into the center now that you've been in the hospital? And I'm sure your first treatment might have been in the hospital. I know mine was.
No, I didn't have any treatments in the hospital. I
Uh,
was assigned to the clinic at the hospital. Now,
uh,
after however many days I had stayed in the hospital, I went to the clinic and
mm.
they made an appointment for me. And when I got there, they told me, we don't accept your insurance.
Whoa.
So, I called my primary care doctor and she
Mm.
sent me to the clinic I've been going to for the past 18 years.
Wow.
And that was a wonderful experience for me when I got there.
Now that shows they care because a lot of times when you deal with health insurance and things of that nature, you're getting a lot of glitches. As a dialysis patient, as a transplant patient, even people that don't even have the same illness as us and have different illnesses have bumped heads with these people, have had problems with these people, have been harassed or upset by these situations. I know I have when I had the Medicare thing issue. I don't even want to go back to that nightmare. I had to go back to
Mm.
work when I wasn't ready, just because nobody gave me insurance for a few months. Now you need transplant medicine and stuff like that, but some heroes stepped in and
Well,
had my back, so I ain't mad about it. You know what I'm
fortunate,
saying?
right.
Hmm?
Fortunately for me, I had never been hospitalized before other than having children. And when I got to the clinic, I remember this feeling coming over me and this voice saying to me, "You can do this." And
Mm,
everyone there was so welcoming and so nice. And, I didn't really know what to expect, but I
yes.
knew that I had to go. So I went. And
Mm-hmm.
as I said, everyone was so welcoming and so nice and just made me feel welcome. So
Now
I'm
you
like, you can do this. And so
when you
mentally, I prepared myself for whatever was to come because I didn't know what was to come. And I still hadn't looked up the word dialysis. Yeah.
Mhm. Oh my goodness. Wow. Mm, wow. All right. Well, I'm glad that you had that good experience because everybody don't have that testimony. You know what I mean? So I'm glad you had a good experience. I had a good experience too going in. My first treatment wasn't a good experience, but my first place and the center was pretty good. You know what I mean? So
Well, for
now,
me, I was fortunate in that the doctor that I was assigned to was the
yes.
head of the peritoneal department. And so she said
Ah,
to me, "I think you'd be a good candidate for peritoneal. However, I need you to go down the hall to the hemo clinic and talk to," she told me who to talk to and look around and ask questions, whatever, because that is an option. So I
yes.
walked in the hemo clinic and I saw machines and I heard alarms and I saw blood. I did speak to someone and then I just walked out and said, I didn't know what peritoneal